Hello everyone, I'm Dr. Rohan Khandelwal. I'm the Principal Consultant Breast Surgeon at CK Birla Hospital, Gurgaon. I head the breast clinic at CK Birla and we see a lot of patients with benign breast disease on a daily basis. What exactly is benign breast disease? Well, benign breast disease means non-cancerous lesions of the breast. Now, before I start explaining to you what are the non-cancerous lesions of the breast, I would like to highlight that you at home cannot differentiate between cancerous lesions and non-cancerous lesions. So if you have any breast-related symptoms, it's best to visit your doctor and get them evaluated properly. Now, non-cancerous breast lesions, they can range from fibroadenoma, which is the most common cause of a lump in the breast. Now, this lump is non-cancerous and it usually affects ladies between the age groups of 20 to 30 years of age. This lump would be firm in consistency. It is usually painless, not associated with pain, and it moves all around the breast. So, most of the times patients come and tell us that I have this lump and it's moving all over my breast. Now, if it's a regular fibroadenoma, we can clinch the diagnosis just based on an ultrasound and we don't need to do a needle test in all these patients. But if it is an atypical fibroadenoma, then we need to do a needle test to confirm the diagnosis as well. Not all fibroadenomas require surgery, and when I discuss with my patients, I tell them there are certain indications where we need to remove it, but most of the cases don't require removal. So those indications are: number one, if the fibroadenoma is rapidly increasing in size. If it's more than 5 centimeters in size, that's called a giant fibroadenoma. If there's a family history of breast cancer in that lady, or if the fibroadenoma is causing them a lot of pain, or it's a cosmetic blemish. These are the 5 indications when we remove a fibroadenoma, and it is usually done as a daycare procedure with a very small incision. At CK Birla Hospital, we also offer scarless fibroadenoma surgery, where we remove the fibroadenoma using minimally invasive techniques so that it doesn't leave a scar behind. So this is one of the common benign breast conditions I just spoke about, fibroadenoma. Another condition is fibrocystic breast disease. Now, patients with fibrocystic breast disease usually come to me between 25 to 40 years of age, and they come with breast pain. Now, this breast pain is usually cyclical in nature. That means it is more before the menstrual periods, before the cycles, the patient has more pain. But as the cycles start, the pain gradually starts subsiding, and it will gradually build up again in the next cycle. So fibrocystic disease is commonly seen in those patients where there's hormonal imbalance. Other trigger factors for fibrocystic disease are stress. A lot of times I've seen patients who are stressed because of personal or professional reasons will land up to me with breast disease and aggravation of their fibrocystic symptoms. Now, fibrocystic disease can be diagnosed by examination and by an ultrasound, and we usually treat it by medicines and lifestyle changes. Lifestyle changes would include some amount of weight loss, reduction in caffeine intake, wearing a well-supporting sports bra. Also, we tell these patients to practice relaxation exercises which can do away with the stress, and the pain can gradually subside. Sometimes patients can develop cysts. Cysts are fluid-filled cavities in the breast. They can either develop in association with fibrocystic disease or can be an isolated finding as well. If these cysts are small, then we don't do anything surgical in these patients. We just clinch the diagnosis using an ultrasound and we just monitor these patients. But if the cyst is quite big or it has atypical changes which might be suggestive of a cancer, then we will aspirate the cyst, remove the fluid out of the cyst and send it for testing. So these are some of the common benign or non-cancerous conditions of the breast. I would again like to highlight that you cannot differentiate between a cancer and non-cancerous conditions at home. So if you notice anything wrong with your breast or any breast related symptoms, please do visit a doctor for proper evaluation. Thank you.